الباقي في القاعة اللي برا. كل طاولة من حقها تختار السؤال، واللي مش عاجبه السؤال اللي هو في الطاولة اللي فيها ينتقل للطاولة اللي فيها السؤال. وحنكونوا معاكم 6 مجموعات، وكل مجموعة 6 مجموعات رئيسية، وكل مجموعة عندها في نقطة هنا سألها الدكتور جمال، قال لي في أسئلة، هل في أسئلة رئيسية؟ أوكي، خلينا في جماعة طلبوا أن يطرحوا أسئلة، فتفضلوا نسمعوا الأسئلة باختصار شديد 5 دقائق وننتقلوا إلى الدسكشن. تفضل دكتور. خلينا نجاوب الأسئلة ودير السؤال. عندي 6 ثيمز وصلوا 25 سؤال أو 26 سؤال. 16 خلاص حددت 16.
بسم الله الرحمن الرحيم. Thanks for this nice presentation. I would like to ask question. Now, the last many years, they are. Okay, you are listening. Okay. In the last many years, we have many colleagues who is taking this handbag with medicine and bringing a chart with him. And this is, they say, evidence-based and so on. What's the best policy to control this? I said many questions for them. Where is the evidence base? He just put this. Thank you. Thank you.
خلينا نجاوب بعض النقاط بسرعة على الأقل تسهلنا الدسكشن. الدكتور سأل أن فيه drug grips. This is what you mean. They promote new drugs and they say what they have is evidence-based. In fact, it's normal that there are drug rips all over the world. But what's abnormal is that there is no regulation to show them what they have to do and to punish them if they do it wrongly. So everybody currently is doing whatever he wishes or she wishes because there is no government regulation or government control to this. And in fact, you as a physician, there should be a reliable, unbiased information source or resource where you get your unbiased information. This drug rep does not provide the unbiased drug information. تفضل. في حد هنا، في حد عنده سؤال هنا، تفضل. الميكروفون اللي عندك وين دكتور؟ تفضل.
Very informative presentation. لكن ما تطرقتش إلى التخصصات الجديدة اللي ممكن كان بي implemented في الفارماسيس أو pharmaceutical sector.
يبدو لي نفضل أن نبدو الدسكشن، ولو حد عنده سؤال حنكونوا معاكم، الفاسيليتيترز حيكونوا معاكم ونقدروا نخشوا فيهم. انتوا جروب رقم 2. سؤالكم 2. جروب رقم 1 سؤالكم رقم 1. هم مجموعة الأسئلة اللي في تيم 1. 3 مجموعة مع بعض. كم حالك؟ لا يخليك. معلش هو دكتور هدية مجموعة كبيرة حتى هي اليوم دكتور هدية.
هو سيدنا عمر اللي هو رجعنا. دير عليه تشيك. دير عليه تشيك.
انتوا مجموعة 3. أكيد عليه. انتوا الثيم 3. الأسئلة اللي في الثيم 3 بالله نسقوا مع بعض كلهم يحكوا مع بعض.
ويب سايت عشان حتى الكلام المكتوب في الحديث خليته حتى انه هو حديث ضعيف.
تمام.
انه هو حديث ضعيف يعني في اللي يقول لك ما عنديش عليه دليل وفي اللي ينكر بكل ما دام حديث ضعيف.
نعرف كل مجموعه اختارت اي سؤال باش نوزع عليهم بس.
نور يا دكتور. الله يسلمك الله يبارك فيك، ولو عندك دليل اعطيه لي حاضر. presentations of two groups. Otherwise, we start with the presentation of Group 1. Group 1, please. إذا تكرمتوا عشان ما نتأخروش على فترة الغداء. We start with the presentations. عندنا two presentations, Group 1 and Group 3, I believe. And we go ahead.
السلام عليكم.
إذا سمحتوا, we have to start with the group's presentations. فlet's start والمجموعة اللي حيكملوا in between يعطونا البرزنتيشنز بتاعهم. شكرا. تفضل دكتور. تفضلي دكتورة.
السلام عليكم. We have 5 questions to address in our group. The first one, how to establish and update the national specification list, including Assalamu alaikum. We have 5 questions to address in our group. The first one, how to establish and update the national specification list, that's the NSL, including the national drug list. Our answer that we come up with in our group, first one is to establish a pharmaceutical authority or committee including qualified and transparent pharmacists, doctors, dentists, and vet. And the second one is regular update of the drug list annually. Third point, drug list must be arranged according to the drugs in the primary health care, drugs for the hospital, drugs for the for specialized drugs like, for instance, nephrology and transplant. And the fourth one, drug approved for private sector. Number 4, we come up that we need to ensure clear recommendation for doctors to write the generic names, because most are not aware and there's difference between the brand names. Second question, how to establish and update the Libyan national formulary. We come up with that we need to establish LNF and create a new reference to be used by Libyan and foreign professionals, including doctors, pharmacists, dentists, and vet, and should be sponsored by the private company under the cover of the Minister of Health. Also, we need to update this LNF annually, and the drug of national list should be barcoded, so there will be no, cheating around. The third question, do you agree about that one drug authority for the entire pharmaceutical and medical supply sector activity should be established? We say yes, and how to achieve that? We say that it should be one authority with subdivision for all of that. Next question, assuring quality control of drugs and medical supplies. We said that we need to create a new advanced high-tech center across all Libya. No drug entrance should be imported to Libya without quality control and quality assurance to be registered after that. And the people who's in charge should be qualified in all of that. The last one is pharmacovigilance. The question asked can be a reality. We thought it's yes, can be. And how to achieve that? Through the expert inspector who arrange regular inspection to the pharmacists all over the country, including public and private sector. And the inspector should be expert pharmacist inspection, including drug expiry date, source of drug storage, cold chain, etc. Thank you.
Do you have any questions?
If there is any question.
في أسئلة، في حد عنده سؤال؟ تفضل دكتور.
Yeah, it's very simple. Like we can do something like we can advise the doctors to have a stamp And when they write a medication or a new prescription or a refill, they can put the generic name and stamp it, or we can make it as a law. The pharmacist, okay?